Here we are now, part 14 of the blood vessels, page 742. And I bring your attention to this more or less schematic diagram that is a diagram that is, how shall I say, representing the analog of these diagrams right here. And we're going to talk about them in the analog sense in a moment. But first I need to address a few things here because this is a interesting looking diagram, is it not? Here in fainter blue we have the long inferior vena cava coming back up and heading through the diaphragm to the heart. We have renal vessels right here, left and right renal veins coming from the kidneys. Okay, but there's this big overlay right here, and I want to draw your attention to that. This big overlay consists of the blood vessels that are serving the small and the large intestine. Okay, and so these blood vessels are, how shall I say, various tributaries of the inferior and the superior mesentery. Okay, so here we have this big thing right here. So this is all sort of like the sort of watershed, as it were, of the superior mesenteric. This is all the watershed here. And I have to put it in those terms because our small intestine alone is like 18 feet long, and then we have our large intestine, and the stomach is actually flowing into this as well. And this is the spleen right here. This is the splenic vein. So this is the spleen, the stomach, the small and the large intestine, all flowing. And you have to think to yourself that not much crosses the boundary in the stomach, maybe a little alcohol, a little aspirin from time to time, and maybe some other things like that. And of course we turn over blood cells in the spleen. But the main constituents of our digestive system come from the capillaries of this entire sort of network of vessels. And so I refer to this then as capillary bed number one. Capillary bed number one starts here, and then we pick up that nutrient supply from the digestive system. We're in the venous system. We're traveling in the inferior and superior. The inferior actually is going to empty into the splenic. The splenic is going to be a tributary and join with the superior mesenteric to become this unit right here. This unit is referred to then as the hepatic portal vein. Okay, so let's enlarge that. So we have the superior mesenteric and the splenic. After it's picked up, the inferior mesenteric, the splenic, is going to join with the superior mesenteric to form the hepatic portal. The hepatic portal is then going to empty into the liver, which is made up of sinusoids. And the sinusoids are, in fact, sinusoid capillaries. So now we're in capillary bed number two. Whenever we go from a capillary bed to a capillary bed, we are going through a portal system. That's what it's referred to, and hence we have the hepatic portal vein. Okay, so this is an important detail. This is actually overall referred to as the endogenous circulation. So you'll have to refer to Claude Bernard and some of the early 20th century, late 19th and early 20th century physiology writers to come up with the terminology that's discussed here. And much of physiology has been grown from this particular milieu, this internal milieu. This is the endogenous circulation. So we've picked up our nutrients. We've taken to the liver. The liver is regulating what's going on here. First of all, it's the first to get all this information. It's going to detoxify. It's going to change glucose, any glucose that's available that is more than what immediately is needed by cells is going to be turned into glycogen. After a certain amount of glycogen is made, then the rest of it's going to be turned into fat and stored in the adipose tissue. So the liver has many responsibilities at this moment. And then, of course, from the liver, we're going to end up with the hepatic vein, and it's going to flow back into the inferior vena cava. If you study this picture and understand it well, then you will not have a problem in the digestive system, because the digestive system presupposes that you understand this. Okay? Moving right along, let's, they give us the sort of backbone system here that is independent of the digestive system. So we have the blood flowing here from the lower extremities up into the pelvis. These pelvic veins here are, I'm not seeing, here we go. This is the external iliac, and then we have an internal iliac right here. Oh, this should be internal iliac, and then we have common iliac up here. So as you can see, the internal and the external iliac flow together to form the common iliac. The common iliac is a tributary of the inferior vena cava. The inferior vena cava is bringing blood up through the diaphragm. There's a couple of little tricks here. First of all, we have our renal vessels, left and right renal veins coming from the kidneys. And then you'll notice that there's some interesting things going on here in addition to all that. Let's take a look at this unit right here. This is the right gonadal. Gonadal really just means it's either the testis or it's the ovary. So it's testicular vein or the ovarian vein is coming up this way and emptying into the inferior vena cava. And then over here we have the left gonadal, which is testicular or ovarian. And notice that it's not going over here. Notice that instead it's actually emptying here into this very elongated left renal vein. Wouldn't that be something if it turned up on a quiz, which it does turn up on a quiz. Okay, so I just need you to sort of be aware of that. And we have our ascending lumbar here on either side, which is actually going to be, how shall I say, congruent with the azygous and hemiazygous. So there's that going on there. Okay, now if we come down to this diagram here, then we get to see how we have our inferior mesenteric and our superior mesenteric picking up all the blood here from the intestines. We have our splenic, here's the spleen over here, hugging the fundus of the stomach, and it's issuing blood this way in the venous system. There's the splenic vein. It picks up the blood from the inferior mesenteric, continues to be the splenic. It then is going to join with the superior mesenteric to become the portal, hepatic portal, which is going to flow into the various parts of the liver, after which the liver has its hepatic vein flow into the inferior vena cava. And we're all set with that. Okay? And then we finally end up here with, this was the external iliac. This is the femoral now. We do have a branch of the femoral that goes deep. We have this audacious, amazing, how shall I say, redoubtable unit right here. This is called the Great Saphenous vein. Let's take a look at that Great Saphenous, and it's going to go across the ankle here on the medial side, along the leg here on the medial side, and empty. This is a huge vein that brings cutaneous blood up, right up there. We're going to have our three branches here coming. Notice that we're going to go back to the popliteal. Let's look at the popliteal back here. Continuation, as it were, of the femoral vein is the popliteal. And we're going to divide into three branches here. We're going to have our posterior tibial. We're going to be having a penetration here at the anterior. And then we're going to be having something over here on the far side called the fibular. Over here on the anterior, when it penetrates through, let's have it be penetrating through, it's going to come down this way. Here it is penetrating through. And we're going to have the Dorsalis Pedis, which then forms an arch here. It penetrates the foot, forms an arch on the bottom, and we're all set.